Right now, somewhere in your body, something hurts. Maybe it's your back. Maybe it's a headache sitting behind your eyes. Maybe it's a tooth that's been quietly threatening you for 2 weeks. And here's what you're going to do about it. You're going to open an app, find a doctor, drive to a pharmacy, and walk out with something that will make it stop. The whole process takes maybe 3 hours. You won't think twice about it. Now imagine that same pain, same body, same nerve endings, same signals screaming up your spine. But it's 50,000 years ago. No pharmacy, no doctor, no pill, no surgery, no anesthetic, no diagnosis. No explanation for what is even happening inside your own body. Just you, the pain, and a tribe of 30 people who have seen this happen before and have absolutely no idea why. What did they do? The answer is not what you're expecting. Because for most of human history, the way humans dealt with pain was so sophisticated, so specific, and so different from what we do today, that modern medicine is only now beginning to understand how much we lost when we replaced it. Before we get into what they did, we need to understand what they were dealing with. Because modern people dramatically underestimate how much physical pain ancient humans lived with on a daily basis. Start with teeth. Archaeological analysis of ancient human skulls tells a consistent story. Tooth decay, cracked teeth, abscesses, impacted wisdom teeth. Without any way to pull a tooth safely or drain an infection, a bad tooth could mean weeks or months of the kind of pain that modern dentists would immediately medicate. An untreated dental abscess doesn't just hurt, it spreads. Into the jaw, into the bone, into the bloodstream. People died from toothaches, not from the tooth, but from the infection that had nowhere to go. Then there were injuries. Hunting large animals with handheld weapons means getting close. Getting close means getting hurt. Broken bones, torn muscles, deep cuts, dislocated joints. The skeletal record is full of healed fractures that tell stories of people who survived injuries that should have been fatal. The skeleton of a Neanderthal man found in Shanidar Cave in Iraq, dated to around 45,000 years ago, shows healed injuries so severe that researchers believe he was blind in one eye, had a useless right arm, and walked with a significant limp. He lived with those injuries for years. Someone fed him. Someone cared for him. And he was in pain every single day. And then there was childbirth. Women have been dying in childbirth for as long as humans have existed. The ones who survived often did so through pain that has no modern comparison, because there was no modern option. This was the baseline. This was ordinary life. So how did they survive it? The first answer is the one that surprises people the most. They had medicine, not primitive, accidental, random medicine. Sophisticated, tested, accumulated medicine that had been refined across thousands of generations of watching what worked and what didn't. In 1991, a frozen body was found in the Italian Alps. His name, given by the researchers who found him, is Ötzi. He died approximately 5,300 years ago, shot in the back with an arrow. And the ice preserved him so completely that we know what he ate for his last meal, what parasites were living in his gut, and exactly what he was carrying when he died. Among his belongings was a medical kit. Researchers identified 35 different plant species in his possession. Several of them have since been confirmed to have genuine pharmacological properties. He carried birch fungus, Piptoporus betulinus, which contains oils that kill intestinal parasites, the exact parasites found in his gut. He wasn't carrying it randomly. He was treating himself. But Ötzi was 5,300 years old. That is practically yesterday compared to the full span of human history. The real question is, how far back does the plant knowledge go? In 2012, researchers studying Neanderthals, a separate human species who died out around 40,000 years ago, found evidence of yarrow, groundsel, ephedra, and other medicinal plants deliberately placed in a Neanderthal burial site in Iraq. Some scientists dispute the interpretation. But the plants were there. And those plants are not random. Yarrow has been used as a wound healing agent and pain reliever across cultures on every continent that it grows on, independently discovered, repeatedly, by people with no contact with each other. That pattern, the same plant used for the same purpose, discovered independently over and over, tells you something important. It wasn't luck. Here is where it gets genuinely interesting. Because the most powerful pain relief ancient humans had wasn't a plant. It was each other. In 2016, a study published in the journal Current Biology measured pain tolerance in volunteers while they were alone versus while they were holding the hand of someone they loved. Pain tolerance increased significantly with hand-holding. Not because of distraction, because of genuine neurological change. The brain literally processes pain differently when another person is present. Ancient humans didn't know the neuroscience, but they knew the result. Every traditional culture ever studied has communal responses to pain and illness. You don't suffer alone. The group comes to you. People sit with you. They touch you. They talk to you. They tell you stories. This wasn't just comfort. It was treatment. Touch releases oxytocin, a hormone that directly suppresses cortisol, the stress hormone that amplifies pain signals. Being witnessed in your pain, having someone look at you and acknowledge what you're going through, activates the same reward pathways as food and warmth. And storytelling, the thing humans did every night around the fire, has been shown in clinical studies to reduce perceived pain intensity. Narrative literally changes how the brain interprets pain signals. The shaman, the healer, the elder who sat with a sick person and spoke over them for hours. They were not doing nothing. They were performing a neurological intervention that modern medicine is only now starting to formally study under names like narrative medicine and social pain modulation. Ancient humans had no hospitals, but they had something hospitals have systematically removed from medicine: the constant, physical, witnessed presence of other people who cared whether you lived. And for most of human history, that might have been the most powerful medicine available. Here is the uncomfortable part. Not all pain was treated. There were limits. There were people who couldn't be saved. There were injuries so severe, infections so advanced, pain so constant, that no plant, no community, no surgical knowledge could fix them. And what happened then reveals something about ancient humans that is harder to hold in your mind than any shocking fact about surgery or shamanism. They stayed. Researchers studying hunter-gatherer groups across the world have found the same consistent pattern. When someone in the group becomes seriously ill or injured, the group does not move on without them. Even when moving on would be the logical survival decision. Even when staying meant the entire group faced risk. They slowed down. They adjusted the camp. They carried people who couldn't walk. They shared food with people who couldn't hunt. They sat through the nights with people who were dying. The Shanidar Neanderthal I mentioned earlier, the one with the blind eye and the useless arm and the limp, survived his injuries for years. He could not have survived alone. He could not have hunted. He could not have kept up on a migration. He was kept alive by a group of people who made the decision, repeatedly, every single day, to carry the weight of someone who could not carry his own. This is not a small thing. This is the foundation of what we call civilization. The decision that a person's life has value beyond their productivity. The decision that the group is responsible for its weakest members. We didn't invent that value in a philosophy class or a church. We carried it in our bones for 300,000 years before anyone wrote it down.